Okay. We're going to talk about patients getting ignored. Bumper going on. You guys ignore me. What are you talking about? You don't even listen to my show. Bumper going on still. All right, guys. We are back on the Dr. Daliah Show. Thank you all for tuning in. 1-877-DOC-DALI, 1-877-DOC-DALI. So one of my listeners tells me that whenever she goes to the doctor's not even looking at her. Sitting there on the computer, right? You know, talking to the nurse, making sure this is filled out, this is filled out. Patient feels like they're just talking to a wall. And we were just talking about in the last hour how a lot of GPs in England feel like they're on a treadmill of just never-ending patients. And they feel like they can't do medicine because they're so busy on the computer and filling out paperwork and making sure all the guidelines are met. And I'm seeing this a lot. I have never thought I would see medicine transform. Now remember, I trained in the 90s. And in the 90s, you were trained to sit and look at a person and have eye contact. We were trained as doctors to make eye contact with the patient and to look at them and listen to them. And yeah, if you have to write something down, you write something down, right? But talk to them, hold their hand, you know, be as humanistic as possible. And then if you work for somebody, there's a computer and everything has to be electronic. See, me, I could write while I look and I could do a lot of things by hand. I could do shorthand. I could do a few things. But when it comes to computers, I got to stop and type and make sure I'm being accurate and hitting the right button and hitting the right cursor in the drop-down menu. And I find it very, very distracting. And then there's all these rules and regulations and all sorts of stuff. So like if you work for a federally qualified health center, the government has certain guidelines that you have to do, that the providers have to do. So that takes a crap load of time. And the GPs in England are worried that they're going to miss something. The patients here in America are feeling like things are getting missed. And I, as a doctor, can't stand the way medicine's going. This is not how I was trained, and this is not how medicine's supposed to be. I told you medicine's an art. Okay, we have a paintbrush. You're a canvas. Right? And it's a blank canvas every time. I don't give a damn if I had 5 people with the flu before you. I'm not going to diagnose you with the flu if you tell me that you have fever and a cough. I am going to start with a blank canvas and go, well, cough, fever, maybe it's pneumonia. Right? Maybe it's septic emboli. Maybe I am not going to just assume you have what the whole herd has. And in order for me to do that, in order for me to figure out what's going on with you, I need to spend time with you. I need to look at you. I need to get a feel of what's going on. Telemedicine, unfortunately, prevents a lot of that because you got a lot of barriers, and we've talked about that with telemedicine. Offers a lot of good to people who don't have access, but it completely changes the way medicine is done for those of us trained old school. But I don't want to be distracted. And the one thing I'm seeing is medical providers, nurse practitioners, PAs, doctors, we're all getting distracted by all this other crap that we have to do. And you see the stories, and, you know, the media's talking about, well, doctors getting burned out, which is one of the biggest risks to the healthcare system. Yeah, doctors are getting burned out, but you're kind of missing the story. You're making it sound like we're getting burned out because we can't go golfing or because we can't let a pharmaceutical rep take us to dinner. People hate doctors. People have been ripping on doctors the whole time. I know what you guys say about us. You hate us. We are the most hated people. I don't understand. All we did was accept a pen from a pharmaceutical company. And you know what? Where is my pen? Do I have a... No, I got rid of the pens. It made everybody so upset. I do not have any pharmaceutical company pens. Okay? You can start liking me again. But, you know, people think the opioid crisis is our fault. People think the obesity crisis is our fault. The vaping crisis is our fault. The marijuana crisis is our fault. Everybody thinks everything is our fault. Everybody hates doctors. You know, I'm tired of it. You want to know why we're burned out? We're burned out because when I went to medical school, I had to bust my ass for years to learn volumes and encyclopedias worth of information. I had to go broke. I was waiting tables. I had to forfeit relationships galores. I had to stink of formalin and, work with dead bodies. And then when I get through, I only average maybe 60 cents to $1 an hour because I'm doing 36-hour back-to-back shifts. I had to sacrifice sleep, so I almost sacrificed my marriage. I had to sacrifice starting my family. I had to put myself at risk for tuberculosis and super gonorrhea and syphilis and HIV and flu and all these communicable diseases that I could get because I wanted to take care of people. And I did it because I thought that this is something that the public wanted. And then to find out that the public doesn't even like doctors and that they think all we do is play golf. I don't know how to play golf. I could barely play goofy golf. I don't play golf. And, why would anybody want to go to medical school? Why? I just don't see where the incentive is. But we need you. And patients need you. It just now doctors are being inundated and burdened with all these checklists and, well, don't give antibiotics here and only do this. And, you need to prove to us why you ordered the CAT scan and why you did the antibiotic. No. We are medical providers and medicine is an art. Okay? I don't mind checklist medicine, making sure I ruled out pneumonia, ruled out DVT. I don't mind having a checklist. But don't have non-medical professionals tell us what to do just to save you money. And don't get in the way, all right, of me and my patient. I want to talk to my patient. I want to get their history, and I want to treat them the way I was trained to. Okay, I'm the one that saw a person with a simple toothache turn out to be a full-blown MI. Or somebody who thought they had a UTI to be a full-blown MI. Or someone who had left-sided chest pain that turned out to be a necrotic gallbladder. You didn't, I did. So if I have a patient and something is just giving me my, tingling my spidey sense, let me do my job. Doctors are burned out because everybody is up in our colon. Get the hell out. Leave us alone. Let us work with our patients. Let the patients have access to us. Don't give us 5 minutes or 10 minutes. And don't give us a patient who has been waiting for hours that's ticked off and now they just want to get the hell out of there also. All right, let us just go back to old school. Little neighborhood, little doctor's office on the corner, 1-877-DOC-DALIAH, don't go away.